All right, let's talk about billing drug Medi-Cal. It can feel tricky, but we're going to make it simple.
So you're billing Medi-Cal in California. It seems complex, but it's not magic.
Really, it's just about following a few key rules and guidelines for success. And California is a real leader in this space. They pretty much paved the way.
So first things first, what does Medi-Cal actually cover when it comes to treatment?
The simple answer? Yes. And California's program is one of the most comprehensive out there.
In fact, it covers every single level of care that the American Society of Addiction Medicine recognizes.
But what makes their coverage so unique? Well, they have a few firsts under their belt.
For instance, California was the first state in the entire nation to extend Medicaid coverage to
Peer support services. And they were also the first state to cover this key intervention, contingency management. This really shows how they're pioneering comprehensive addiction care.
Okay, so how do you actually bill for that peer support? It all comes down to the CPT codes.
And check this out. The code for a group setting is totally different from a one-on-one. Just remember, both of those codes top out at 96 units, so you got to track them carefully.
And what about contingency management? This is all about using rewards to encourage positive change. For that, you're going to use CPT code H0050, which covers one 15-minute unit.
Okay, here's a huge one. Does Medi-Cal cover medication-assisted treatment, or MAT?
Yes, absolutely. The coverage is really extensive, from buprenorphine all the way to Narcan. And here's the rule. Providers have to offer or accommodate patients who choose MAT, no exception.
Another big question we get is about sober living homes. Are those covered by Medi-Cal?
The short answer here is no. It's just not part of ASAM's continuum of care.
But don't get that confused with residential drug and alcohol treatment. That's a different story.
That is covered because it's on the ASAM continuum, both clinical services and room and board.
Right, let's quickly touch on the no wrong door policy. This is super important. Basically, providers get paid for assessments even if the person doesn't have an SUD. Smart, right?
So if you want to go even deeper, what's the one resource you should always turn to?
You have to start with the official drug Medi-Cal billing manual. It's got everything in it. So let's wrap this all up. What's the most important thing to take away from all this?
Look, getting this right isn't just about revenue. It's about your patient's access to life-saving care.